Hey everyone, and welcome back again to my channel, guys. I hope you guys are having a good week. I hope you guys are feeling blessed, guys. And yeah, today's video, guys, it's a pretty interesting video it's mainly for the guys, but obviously the women will benefit as well knowing this information, affects us as well. So today's video, guys, we are going to be talking about, this is a question that a lot of people ask and wonder about, okay? So the topic today, guys, what is the average size of a penis? Okay, average size of a penis. This is a question a lot of people ask just so that they would know. Curiosity kills the cat, guys. We all want to know, not all of us, but some people want to know what the average size penis is. To some people, size does matter. To others, it doesn't. As long as it's doing the job right, the size shouldn't really matter. But this is something that quite a few guys get affected by, especially, when it comes to their confidence in something like that. They would kind of feel somehow about it, especially if they have a small penis. Generally tends to be a problem for guys. But yeah, many people experience anxiety, like I was saying, about whether the penis is big enough to basically satisfy, sexually, satisfy a sexual partner. And this can affect self-confidence, also because they want to make sure that the woman is happy with the size and obviously satisfied. It can actually, for a guy, it can affect the self-image as well, because some girls can be cruel. They can, see something like that that may not be the size that they want, and then they kind of laugh about it or go and talk to their friends about it, making the man feel small and stuff like that. I think that's a bit cruel. There's no need for that. But things like that can obviously, kill someone's confidence. I don't really believe that size matters. I think it's how you use it. As small as it is, it's how you use that penis that determines how big or powerful it is, or it should be. You could have a big penis and not be able to even use it, So I just think that size doesn't really matter. You have to know how to use that thing. You have to just know how to use it to be able to satisfy your partner. Your partner could, during a sexual, intercourse or whatever, they may look at the size, but then it wouldn't really bother them because they are busy enjoying what you're doing. You know how you're using it. You know what I mean? Yeah. I hope you know what I mean. But anywho, let's go straight in the video. So apparently research, most males believe the average length for an erect penis is around 15.2 centimeters, guys, or 6 inches. 6 inches. That's the research anyway. So I don't really pay too much attention to this. As long as you know how to use your penis, I think you should be good. Like, you shouldn't even have to worry, Obviously sizes vary. The average length is probably apparently 12.9 to 13.97 centimeters. So that research is slightly more higher than what it is in real life on average. So let's talk about the different types of penises. So we have the micro penis, and then we have the buried, like you're burying someone, buried penis. Some people are born with a micro penis when a penis is unusually small, usually due to hormonal or genetic, factors. It happens. A micro penis fulfills the same function as an average size penis, but people may feel dissatisfied with its appearance. Exactly. That's, you can look at it and think, what's that gonna do for me? This isn't even gonna go in, or touch where it's supposed to touch, or touch my G spot, or stuff like that. But you will be surprised what a small something could do. Too much info, but yeah. Hormonal treatment or surgery can increase its size if the person wishes, but I don't see the point. It's a waste of money. I don't see the point. But anywho, sometimes an average size penis may appear small because there is additional skin around it. People may refer to this as a buried penis, and surgery can resolve that. So I think this is the one they're talking about, the hanging skin. Not sometimes, when you are born as a male, obviously your penis, the tip of your penis is buried in your skin. The skin is covering it. I will show you a picture of what I mean. If you do have one of that, you would know. So if you look in the mirror, you whip your thing out and take a look at it, you would know if it's a micro penis or a buried penis or a large penis. You would know what kind of penis you have. So we do have the ones that are buried inside. The skin is overlapping, covering it up. And sometimes you can get the dirt. You have to be very careful hygiene wise to make sure that thing is being cleaned. You pull the tip out and clean it properly. But yeah, so usually when a child is born a male and has the hanging skin on, they have that's their foreskin. They have it cut off during surgery, and it takes about 2 weeks, maybe more, to heal. I never knew about that until quite a few years ago. But that is something that men do have, and if it's not done when you're a baby, you end up having it like that. Is just having to maintain it, and also deciding whether you want to have the surgery at that certain age that you are. It's completely up to you. But there is such penis called buried penis. I'm going to show you pictures of that as well. Okay, so for those who, I think maybe some people are lost in what I'm talking about, if you're a virgin or if you have no knowledge of what a penis is, I'm just gonna kind of explain quickly what it is. So the penis is the male sex organ. Its primary function include the reproduction, and also you use it to obviously urinate. No two penises are the same. Every penis is completely different, and they can vary in length, appearance, width, the color, just same as a woman's reproductive organ as well. Same as well, knowing your anatomy of the penis helps you distinguish if there's any unusual or abnormalities around it as well. Okay, so we're going to have a look at the anatomy of the penis, guys. So the term penis basically refers to the root, the body, and the glands of the genitals. So the rest of the male's sexual anatomy includes other external parts such as the scrotum, and internal parts such as the testicles. Okay, the penis contains soft, spongy tissues as well as muscles, fibrous tissues, veins, arteries, and the urethra as well. So these allow the penis to perform, allows the penis to perform its functions. The two main functions of the penis include the sexual intercourse and also for urination as well. When a person experiences arousal, the penis fills with blood, causing an erection. So as such, erectile function is closely related to a cardiovascular health. So the erection basically enables a person to penetrate a partner and have sex. Following sexual activity or a manual stimulation, a person can then ejaculate. After ejaculation or loss of arousal, the penis can return to a flaccid state. Now, the penis can also play an important role in the urinary role. The penis contains the urethra, like the female, which allows passage of urine from the bladder to the urethral opening, enabling the person to expel the waste from the body. Okay, so the anatomy of the penis, we have the root. Now this, guys, is the part of the penis attached to the body, and it is not visible externally, right? So it contains 3 erectile tissues, which include 2 crura and the bulb of the penis, and the 2 muscles called, I'm not even going to attempt these names, the urethra connects to the bladder and passes through all parts of the penis. Now, the body of the penis, or the shaft, is the free part of the penis between the root and the glans. So it contains 3 cylinders of erectile tissue, which includes 2 corpora and corpus. Now we've come to the glans. This is the most distal or end part of the penis, which is the top. It gets the shape from the bulbous expansion of the corpus. The glans also feature the urethral opening, guys, which is where the urethral ends, allowing a person to expel urine and semen. So the erectile tissues, guys, these are the tissues that fill with blood during arousal, which allow the person to have an erection. So types of penises. Obviously, there's different types, different appearances, different measurements, different lengths. It changes as well when it erects as well. So when a penis erects, it may be straight, some may have a bend, some may curve. It depends on the individual, and some have the foreskin on it, and some have that, through surgery, having that removed is called the circumcision. That's what I forgot. Couldn't think of the name. So some people have that circumcised, to be free enough to let it get to it, like use it how they would want to. Now, with the penis comes with certain conditions as well that may affect the penis. So I'm just going to list a few just for you to be aware of in case you notice any abnormality with your organ. So penis infection, guys. Many infections can affect the penis and cause painful symptoms such as redness, swelling, itching. There's quite a few things that happen. Sexually transmitted infection, STI, that we spoke about, that has to be checked. Things like chlamydia, gonorrhea, genital warts, syphilis. These are all infections that needs to be checked, guys. Erectile dysfunction as well, guys. This is typically refers to when a person has difficulty in getting or keeping a firm enough erection to have sex. This is when you can't, get a stiffy. And then you have the priapism. This is when the blood becomes trapped in the penis and can cause a prolonged and painful erection that can result in permanent tissue damage. And there's another one where there's a condition where the bands of the tissue pulls on the penis, giving it a bent appearance. And then you have another one where the scar tissue forms under the penis skin and causes abnormal curvature of the penis. Urethritis is an inflammation and swelling of the urethra, which can result in painful difficulty in urinating as well. Micropenis is obviously abnormally small penis due to hormonal or genetic issues. And then you have the buried one, which is the medical condition where this excess skin and fat covers the penis, making it less visible. Okay. And then you have the penile cancer, where this is a rare type of cancer that develops on or in the penis as well. So guys, yeah, you have to look after your penis. This is something that you need. Yeah. So any issues, guys, seek medical attention. Just make sure hygiene wise regularly wash the penis with a mild soap. Try and avoid any abrasive or heavily scented products on that area, guys, so that it doesn't irritate it. And then people can also use this time to check the penis for anything that appears unusual or different. As well, make sure you check the testicles, which are the two balls below it, for lumps and stuff. And also during sexual activities, guys, try and use condom when having sex, and also undergo regular sexual health screenings as well if you can. Make sure you get good healthy diet going, you know, get regular exercise going, get the blood flowing in the system and through the penis as well. Yeah, pretty much. That's pretty much what you need to do, guys. So I hope that was enough information for you guys. And yeah, once again, take care, guys. And I'm going to see you in the next video. Stay blessed.